Welcome to Health Matters. On the occasion of International Women's Day, we bring to you a very special edition with Dr. Sophia Rodrigues, consultant obstetrician and gynecologist, who has been in practice for the last 12 years in various hospitals in Mumbai and Goa. She is presently at the Manipal Hospital in Donapaula, Goa, and her areas of interest are high-risk obstetrics and adolescent health. Dr. Sophia, thank you for your presence in our studios today.
Thank you so much for inviting me over here, and I would like to thank CCR TV and St. Luke's Medical Guild for inviting me to this platform. It's a privilege to be here.
Great. On the occasion of International Women's Day, which is celebrated on the 8th of March, let's get right down to it and dive into some very foundational questions on the subject of women's health. And the first thing that I would like to ask is, when should one start visiting a gynecologist and how often should they come to you?
One should start visiting a gynecologist preferably right from the age of 16 to 18 years. It is mandatory that you visit once in a year because many of the illnesses or gynecological related problems are being diagnosed when you come to a doctor itself, and you get a lot of knowledge which will help you to treat yourself better and early.
Okay. Now, can you tell us about tampons, pads or sanitary napkins and cups? How should they be used and how do they compare for a user?
For generations, we have been using initially cloths, and then it shifted over to pads, both cotton-based pads and gel-based pads. Then now tampons have come into the market, and a very new thing and a very useful thing which I would suggest is this cups, vaginal cups. Okay, so we'll go down to each one of these. The pads, there are two types, cotton-based pads and gel-based pads.
Right.
But the problem with pads is sometimes there can be overflow and staining of clothes. Also,
Right.
when you're doing various activities like swimming, cycling or sports activities,
Yes.
they are not very comfortable.
Yeah.
Whereas tampons play an advantage in this fact, in the sense if you're going for a swim, you can very easily put it in over there. Only disadvantage of a tampon is in unmarried girls where the hymen is intact, you may not be able to put a tampon in.
Okay.
Okay. Thirdly, the cups that are coming, they are made of high quality medical silicone. So they are very comfortable, they are eco-friendly, they are very friendly on the pocket because each cup, they come in various sizes, small, medium and large size, and
Okay.
it is quite simple. Initially we might have a hesitation in using it.
Okay.
Each cup can last for at least 8 to 10 years, which means it's so
wow.
pocket friendly, and the headache of disposal of pads in public places is not there.
Right.
At the end of every menses, these cups can be sterilized with warm water and kept in a nice clean dry packet, and you can reuse it in the next menstrual cycle.
And are these easily available?
They are easily available online,
Okay.
not very easily available in the pharmacies or in the market, but
Okay.
very, very easily available. The cost is quite effective. It's cost effective, ranging anywhere from 1,000 to 2,000 rupees, but that's worth it because it will last for 8 to 10 years.
Correct. That's right. Okay. So now if someone misses their period, is that something to worry about?
Yes, you might be pregnant if you are in the reproductive age group. This is the first thing we say is do not miss a pregnancy in the reproductive age group. Many times we fail to question our cycles, we fail to track the cycles. Okay. The moment you miss a period, and if you are sexually active or you are married,
Okay.
first thing that should come to your mind is pregnancy. Many people think it's not, and then they delay, there's a delay in diagnosis and even coming to a doctor. And by the time they realize they're pregnant, it's quite late if it's not a planned pregnancy.
Okay.
The second thing that could be the reason for irregular menses is hormonal disturbances, which is quite common nowadays, like PCOD, which is polycystic ovarian disease, which will be coming down further to explain in the session of questions that you will be asking me. Also thyroid problems are becoming quite common now, and there are various other hormonal issues which can create irregular menses.
Okay.
Yeah, Runa?
Yeah. So now you just talked about tracking your cycle.
Yes.
How does one learn to track one's cycle?
It's very important to remember when you get your menses. It's as
Okay.
simple as that, but we fail to do it because we are so busy with our professional lives, or we are so busy as housewives, we fail to write it down. So just on a calendar, it's a simple thing, just write it on the calendar, the date that you have got your period. So the next time when you get a period, you will be able to easily track a cycle, whether you were late in getting the next cycle, whether you were early in getting a cycle, or whether you have missed a period.
Okay.
This is very important. For example, Runa, I would like to just discuss one case which came yesterday to me in the emergency of Manipal Hospital, and just for the pure reason that she forgot the dates, the case was missed out. And this case was a case of a tubal pregnancy, okay, that's called ectopic pregnancy in medical terms, and the patient came to us with lot of bleeding, almost 1 liter in the abdomen, because the pregnancy ruptured in the tube. And the reason why she didn't realize it is because she simply forgot her date, and she didn't realize she could have been pregnant. So she was overdue by 10 days, and if probably she had realized it 10 days back, she would have done a pregnancy test on the urine kit and realized it much earlier. She wouldn't have come to us in a phase where she has completely collapsed down, where we had to give her multiple transfusions and take her for surgery. So this is the importance of just one example where it's very important to track your periods.
Okay. Now, when we're talking about tracking, are cycles the same length for everybody?
Everybody, most people have a cycle duration of, say, right from 21 days to 35 days. So we say 28 days plus or minus 7 days, if that makes it easier to remember, which means as early as 21 days and as late as 31 days is normal. Normal. Also, the duration of flow of bleeding should be anywhere from 2 days to 7 days. That's 5 days plus or minus 2 days.
2 days.
Okay. If it's anything less than that or anything more than 7 days, then it's something to worry about. It's better to go and evaluate yourself, better to go to the doctor and find out what's the reason.
Okay. Now, we started this conversation in the context of pregnancy. So, do safe days exist anywhere in the cycle at all?
If we are really on dot, regular on our periods, regularly the periods come in very regular, then I would say between day 8 of the cycle to around day 22nd of the cycle. To break it down in simpler words, supposing you have got your period on 1st of February, then right from day 8th of February to 22nd of February is your fertile period, which is the unsafe period, which means if you are not planning for a pregnancy and intercourse or sex happens during that time, you could get pregnant. But sometimes ovulation can occur, that is the egg can release even before day 8.
Now, I'd like to go back to something that you mentioned earlier, which was PCOD. Can you talk to us a little bit more about that?
PCOD, if you take the full form of that, it's called polycystic ovarian disease. It's not a disease, I would say it's not a disease, it's a lifestyle problem. Okay. In the good old days, we hardly heard about PCOD.
That's right.
But now every third girl, especially the teenagers and the age group between say anywhere from 13 years to 38 years, we hear PCOD quite commonly. Okay, this is simply because of lack of exercise, and the dietary habits are not proper, as in people don't eat their meals in time. They skip their breakfast, which is the most important meal. They may not eat the right foods, like the home cooked food basically is usually a healthy food. But we become so busy that we want to just pick up something like a burger or a Coke or pizzas, or all these are junk foods. It is because of junk foods and a lack of exercise that many people have now landed up with PCOD. The symptoms of PCOD, what you will start noticing is weight gain. You might see excessive hair or abnormal hair growth in various places like the upper lip, the chin, and you may see acne, that is pimples, hair loss, and most importantly later when they get married, they might be having infertility issues, that is a difficulty in conceiving children. So the ideal thing to do, PCOD is reversible. It's a reversible disease or a disorder. Simply with exercise, good sleep and good dietary habits. So I'll just stress a little on these three, because otherwise also these three form the foundation of good health to everybody. So for example, diet, instead of 3 big meals like breakfast, lunch and dinner, I would break it down into 5 to 6 smaller meals every 2 hourly. That's how your stomach is, it's timed for you to take, there's a timing where you will take your meal in time. It's easier for the stomach to digest, and the brain gets a signal, oh, I don't have to keep the backup food as fat storage. So it is good to have small frequent meals rather than 3 big meals.
Okay.
Also, the most important biggest mistake that people do is skipping breakfast. Breakfast is the most important meal of the day. Okay. The second thing is stick to more of sprouted pulses, fruits, vegetables.
Okay.
Basically, in simple terms, I would say stay closer to the food chain than go to having processed foods.
Right.
Yeah.
Right.
So more of sprouts, vegetables, fruits, and all the other things, chicken, egg. Stay
Okay.
closer to that rather than going to a chicken would be better than a sausage, or an egg would be better than mayonnaise.
Okay.
Something like that. So you stay closer to the food chain. The second thing is exercise. Exercise, people get bored of doing exercise.
True.
Okay, what they will do is when they realize they have gained weight, is they will start with full swing. They'll register themselves to a gym and do everything in the first 7 days, and then they feel bored of it and they give up. So what I normally say is to start with 10 minutes if you're not used to exercise. You keep a goal for yourself. Maybe the following week you can increase this to 20 minutes and then half an hour. The minimum exercise that is required is at least half an hour and more per day. Okay? Because the first half an hour the body breaks down the sugar. After that it breaks down the fat.
Right.
It can be any exercise from swimming to walking to cycling to skipping to playing basketball to anything that you actually love. Don't torture yourself if you don't like the gym to go there and just, because you will not do it over the long run.
True.
So what I do is I keep on changing my activities. So
Okay.
I am having fun at the same time I am exercising myself. Exercise of half an hour and more at least 5 times a week. So 2
Okay.
days you can get a rest.
Okay.
Sleep. Many of us are so busy doing everything, especially with the phones and with the TV and the laptops, and we end up sitting late night on all these
Yes.
gadgets. And sleep is very, very important. Around 6 to 8 hours of sleep in a day is required for everybody, because sleep detoxifies your body. If you get a good night's sleep, for example, the next day you feel so fresh.
Yes, that's true.
And if you don't, you feel like
Yes.
dozing off in the afternoon.
Yeah.
So sleep, exercise and diet are the cornerstones for maintaining a good health for everybody. And the same holds true for the disease PCOD. The
Right.
moment you start doing all of this, in 6 months there will be guaranteed results of 80 to 90% in 80 to 90%
Oh,
of the
wow.
people. Even with a 4 to 5 kg weight loss, periods will automatically become regular, everything will fall in place, and you may not even require medications.
I'd like to ask over here, because you talked about weight loss and you mentioned the word diet. Very often when we look at weight gain, the knee-jerk reaction is to go on a diet,
Yes.
which is different from maintaining the right diet.
Yes.
So can you address that?
Yes. What I would say is, again I would say, don't torture yourself. If you like some foods, please go ahead with it. But if you don't like, some people do binge eating. What happens is they love to eat something and they will not eat it, or they will just go fasting on a diet, skipping meals. But that is a big mistake. It's a
Okay.
big mistake. In fact, I eat 6 to 7, 8 times a day.
Okay.
I eat that much,
Okay.
but all healthy foods. Maybe once in a month I will, go and have a pizza with my daughter, or I will have something which is not very healthy, but it's okay. It's
Right.
okay. Even for example, if you want, you're very tempted to have an ice cream or a chocolate, you can take a smaller portion of the chocolate, a smaller portion of an ice
Right.
cream. You can share the pizza
Moderation.
between 5 or 6 people.
Yes.
So in that way, your taste buds also are met with the taste, and you also take care of your diet.
True. I'd like to go now to an area that is very often not addressed, which is hygiene. Okay. How should we clean the genital area, and how should we maintain vaginal hygiene?
Okay. Vaginal hygiene, basically I would put it in 3 parts. Okay. One is the general hygiene. Okay. Every time you pass urine or stools, or after menses or after intercourse, it is a nice habit to wash the vagina with simple water, warm water and soap. Okay.
Okay.
Nowadays there are a lot of washes, so many things are marketed
Yeah.
out there, like V-wash or Cleanse wash, which are widely available and every other person wants to use it. But these are not advocated regularly to be used, because this can
Okay.
disturb your vaginal pH. And in
Okay.
fact, the vagina has normal bacteria in it, which is called normal vaginal flora. We keep on washing excessively, this normal vaginal flora can get disturbed and abnormal bacteria can grow in over there.
Okay.
Okay. So plain warm water and soap, If there are recurrent infections, on advice of a gynecologist or a doctor, you can use these soaps we wash or medicated soaps which are there. These are
Okay.
basically to maintain the pH, but excessive use of all this is not advisable.
Okay.
Second part of vaginal is vagina, to keep the vagina clean, is sexual hygiene, I would say. Is basically a very important thing. Is many times people end up with urinary infections and
Yes.
vaginal infections after an episode of sexual intercourse,
Okay.
or maybe after a long gap when intercourse has happened, or when you're newly married. Okay, so it's very important point that you need to empty your bladder, that is pass urine before and after intercourse. The
Okay.
urethra, that is the urine pipe in ladies, is very short.
Yes.
So and the vagina is open. So for bacteria from the anal area to go to the vagina, and from the vagina to the urine, it doesn't take time.
Right.
So that's the reason we always say empty your bladder before and after intercourse.
Okay.
Thirdly is menstrual hygiene, that is basically keeping your vagina clean during menses. Is you need to remember to change the pads every 4 to 6 hourly, or tampons every 4 to 6 hourly. That holds true to the cups also.
Okay.
Cotton pads are preferable to gel based pads, because many people experience allergies after gel based pads
Okay.
during menses. And the pads need to be disposed not in the flush tank, but you wrap it in the newspaper and just put it up in the dustbin. Also, you need to use cotton underwears.
Okay.
Wash the underwears with hot water and soap, and not detergents. Okay,
Okay.
detergents have a higher pH. This
Okay.
can also create allergies. Wash your undergarments separately,
Okay.
not in
Yes.
a common washing machine.
Yes.
And very important thing, but a very simple technique which will prevent infections, is washing of the private area with your hand from front to back,
Yes.
not from back to front.
Yes.
Because when you go from back to front, you're taking the anal bacteria, that is the stool infection, this infection that could be there in the stool, into the vagina. From the vagina, you take back into the urethra.
Pubic hair is another area. How does it need to be kept clean?
Okay. Pubic hair is basically created over there by God for protection.
Right.
Protection from what? From germs and dirt from entering into the vagina or the private area. Okay. Many people get so, they feel so awkward offended when they come for a gynec checkup, and they say, doctor, I have not cleaned. But we know you're coming for a checkup. That's normal to have hair over there. I don't expect you all to clean it and come. At the most, many people also shave that area and do waxing in that area, and because of which they'll end up with folliculitis. Basically, it's pus boils. It's nothing but pus boils that you will see, or irritation that will happen after shaving or waxing. The best way to, if you want to take off that hair, is trimming or use clippers. You get these hair trimmers which are quite economical. You can use the hair trimmers there. So there won't be any reaction to any chemicals of waxing or hair removal creams or to shaving blades.
Okay. Okay. Now I'd like to move now on to an area related to, pregnancy and then child care. So what is the right or the ideal age to get pregnant?
You can get pregnant right from the time you get your menses.
True.
That's because it's a green signal from nature. Basically that once you get menses, you ovulate, that is the egg releases, and you could get pregnant. The ideal age to get pregnant, I would put it down to around 25 to 26 years, because you are mentally and physically capable and matured of taking care of your pregnancy and the baby. Many people nowadays, many girls nowadays delay the age of marriage to beyond 30 years because of careers, if they want to settle down and then they want to plan in marriage. I would advise, it's important to do your career, but what happens is, first they get married after 30 years, then they take another 2 to 3 years to decide. By the time they're actually planning on the pregnancy, it's 35 years, and by that time the ovarian reserve drastically reduces. Okay. And in the eventuality, they have to take multiple treatments, infertility treatments, or quite a few number required to even go ahead for IVF or test tube babies. What we say in common terms. So it is advisable to plan at least the first child a little earlier.
Okay.
So, and you can space out for the second child if you're planning for one.
Okay. Now, what are the advantages of breastfeeding a child, and how long should it be continued?
According to WHO, breastfeeding should be given, the child should be breastfed exclusively for the first 6 months of age. And there is no time limit or cutoff limit where, for example, you say, okay, stop it at this point of time. You can continue breastfeeding for 1 year, 2 years, 3 years also. Okay,
Right.
and it is the mother's best gift to the baby because it gives lifelong immunity to these babies. If you see, these babies fall sick less often as compared to babies who are not breastfed.
Okay.
Also, it has a huge advantage to the mother in preventing cancers like breast cancers and ovarian cancers. It helps in losing out the extra pregnancy fat that the mother has built up during the pregnancy,
Okay.
and so many more advantages.
Now, we know of so many brave women who are survivors of breast cancer. I think it's difficult today to find somebody who's not been touched by a survivor in our social circles. Can you tell us about breast examination and screening and some of the early warning signs to watch out
Yes,
for?
Runa. So basically I would advise to do a self breast examination. Self as in you examine your own breast once in a month. We don't even have the habit of touching our own bodies.
Yes,
And
that's true.
if you don't know what's normal, then how will you know what's not normal? Okay, so basically I would say breast examination is to be done once in a month, usually after menses is what I advise, because during or just before menses there are hormonal changes in the breast which will
Okay.
give a false impression of lumpy feel or pain and pain in the breast.
Okay.
So after menses you check the breast with the flat of your hand or the flat of your fingers.
Okay.
Never with the tip of your fingers, because when you check with the tip of your fingers you will feel like there are lumps.
Okay.
So you see, what do you see for? You see for any lumps, any hardness or any discharge from the nipple.
Okay.
Now also remember that the breast is not round. The
Okay.
breast has a tail or in which ends in the armpit.
Okay.
Okay, so when you're checking the breast, you check clockwise or anti-clockwise. Check the nipple, press and see for any discharge, but don't forget to check under the armpit,
Armpit.
because that's where the breast tail is. Okay,
Okay.
so you can miss out on a lump. If you have any doubt of any change in shape of a breast, or there is one is bigger than the other, or you feel there's a lump or there's hardness or there is color discoloration, or you see the orange pill, the dimpling on the orange pill, so if the
Okay.
skin becomes something like that, these are all signs that there could be something underlying abnormal over there. So it's wise to
Okay.
go to a doctor and get yourself evaluated.
Okay. Okay.
So there are various screening tests for this. Besides your self-examination that you will do once a month, there are various screening tests like the ultrasound and the mammography.
Right.
Okay. The ultrasound we normally advocate every 2 yearly or so, once in a year or every 2 yearly, below 40 years of age. The mammography usually we advise for age group more than 40 years of age. Mammography is nothing, people get a lot sight on mammography that is painful and they will just avoid doing that investigation. But mammography is a screening test for breast cancer, okay, wherein they put these two plates and they place the breast between these two plates. The plates press the breast, so there's a little discomfort and an X-ray film is being taken out.
Okay.
It's a good screening tool for detecting any breast cancer lumps or any other lumps also.
Okay. Now, what's a pap smear test and how often should it be done?
Pap smear is a screening test for cervical cancer and to screen for any precancerous lesions in the cervix.
Okay.
So pap smear is normally done say once in 3 years, every
Okay.
3 yearly, right from when you're sexually active. I don't say married anymore because now sexual activity starts even before marriage.
True.
Right from sexual activity, say from the age of 21 years around in India, to every 3 yearly you do it.
Okay.
If twice it's normal, then every 5 yearly.
Okay. Okay.
So how do you do it? How do you do the pap smear? Is basically, again, it's a little discomfort. We do not cut or it's not painful. We don't inject you with anything. It's just like you come for a routine gynec examination. There is an instrument called as a speculum, which basically helps in visualizing the cervix. It's like a duck bill, the bill of a duck.
Okay.
So it just opens, we put it in the vagina. It just opens out over there so that we have a better visualization of the cervix or the mouth of the uterus.
Okay.
Then there is this, you've seen this cotton earbuds.
Yes.
Okay, so something like that. We have brushes, small
Okay.
brushes. So these are we just touch it at the mouth of the uterus, that's the cervix. We put it on a slide and we send these slides for examination under the microscope to see for any precancer cells or cancer cells that may be there over there.
Okay.
Okay. So this is how a pap smear test is being done.
Okay.
And it is very important to get a pap smear done. I've known of ladies who have never done one in their life.
Right.
The simple reason is India is the capital for cervical cancer in the world. Okay, it has the maximum number of cases and it's one of the good cancers, I say, because cervical cancer is a very slow growing cancer.
Okay.
Right from its inception to its formation to cancer, it may take anywhere from 5 years to 10 years as compared to breast. Like you have checked 6 months back, it was not there and now it's come after 6 months.
Okay.
Okay. So, even if you say do a pap test once in 3 years, definitely you will pick up something or the other in a very early stage.
Okay.
So, secondly, why it is a good cancer is because it's slow growing.
Right.
You can pick it up early, you can treat it very well. It's quite responsive if detected in the early stages, stage 1 and 2. Also, there are vaccines that are available. It's the only cancer which is vaccine preventable.
Right.
These vaccine names are Gardasil and Cervarix. Okay. Basically, they are given anywhere from 9 years to 35 years of age.
Okay.
Earlier the better, before sexual activity,
Okay.
because cervical cancer is basically spread through a virus called as HPV, which is human papilloma virus, which is sexually transmitted.
Okay.
So these vaccines block this virus from attacking your cervix or the mouth of the uterus.
Okay.
And hence will prevent or will reduce the incidence of cervical cancer.
Okay. So in the case of both these kinds of examination, both the pap smear test as well as a mammogram or an ultrasound, can the patient ask their gynecologist?
Yes, of course they can
because
ask.
I think that is one of the hindrances towards getting tested. It's that most of the time you don't know where to go.
They can ask and they can demand for it.
Just
It's
ask your
a lack of
gynecologist.
knowledge. Sometimes they are not aware and they don't do it. So every patient who comes for a routine check, I suggest to them,
Okay.
this is to be done. If you have not done it, please get it done.
Okay.
And their screening tests. Initially what used to happen is when we were not well, we used to go to a doctor.
Right.
These were for treatment, like we have a cough or a fever and we wanted to go and treat it.
Correct.
Whereas screening tests are, it's not that you are not well. It's you're going to a doctor basically to identify your problem early. So you treat it early and you don't end up with complications.
Okay.
Yeah?
Doctor, is there anything that you would like to state to our viewers?
The message for today on the occasion of International Women's Day is I would like to say to all my women to please take care of their health, because you all are the foundation, the pillars and the strength of every family. And if you don't love yourself, you can't love anybody around you. So I would like to sum up with a beautiful quote: the hand that rocks the cradle, the procreator, the mother of tomorrow, a woman. A woman shapes the destiny of civilization. Such is the tragic irony of fate that a beautiful creation such as a girl child is today one of the gravest concern facing humanity.
Thank you, Dr. Sophia. It's really,
so
really
much,
a
Runa.
lovely quote, and it's so true. It's so true that that we have a hand in procreation after the Creator, and yet we are facing a threat. It is changing, and there is a lot of dialogue. But the fact that we've reached this stage where it's necessary to even have a dialogue, I think is quite a shame for humanity. However, the fact that we keep a day every year, while one could always say that you don't need to have a day because every day should be a woman's day, the fact that we bring it to mind every year, I think spells hope for humanity. And I'd like to say thank you for
so much, Runa.
all of the information on really very basic areas that sometimes we just don't ask for all of the women out there. And to you, our viewers, we wish all of you, especially the ladies, continuing good health and happy and supportive families.